everybody. My name is Alexis Stratton, and I am the Evaluation and Training Associate at the South Carolina Coalition Against Domestic Violence and Sexual Assault. I'm here today to talk with you about serving LGBT clients, how you can best work with the lesbian, gay, bisexual, and transgender community in a dignified and respectful manner. We're going to split this training up into two parts. Part one will cover some of the terms, demographics, and health disparities related to this community. And part two will look at some of the barriers that LGBT people face when accessing health services, as well as what you can do to overcome those barriers, both individually as well as within your agency. So this gives you an overview as to what this training will be looking at and about. So again, we will first be looking at who is LGBT, so some of the community and demographics, and then look at the health risks and disparities that this community faces. And then the second part will look at barriers and then structural approaches to creating a welcoming and inclusive environment. After part one of this training, you should be able to define key terminology and demographics of the LGBT population, as well as discuss some of the health risks and disparities that have an impact on LGBT people. So let's get started. We're going to start by looking at who is LGBT, what this community looks like, what the terms that are used to describe this community are, and what the demographics are for this community. And we're going to start with terms, and I have a lot of people who ask me, why do I have to know all these terms? Why can't I just call someone gay? Like, why are there so many terms to describe this community, and why is that important? Well, I think it comes down to two things, respect and accuracy. So you want to respect your clients and build rapport with them to have the best healthcare outcomes for your clients. And you want to be accurate. So just in the same way you wouldn't call all Spanish-speaking clients Mexican, that would be considered rude, number one. It would also not be accurate because they might be from Costa Rica or they might be from the United States. They might be from anywhere. Just in the same way that that's not accurate and erases a bunch of their culture, just when you call everybody in the LGBT community gay, that's like the same thing. It's inaccurate and it's not necessarily respectful, and it might erase really important parts of their lives. So we're going to talk about terms first in order to help you know how to build that respect and rapport with your clients. The other important thing to remember about terms is that there are so many of them. There are tons of them, and I've had friends and colleagues who have approached me and been like, Alexis, I understand L, I understand G, I even get B and T, but now there's Q and I and A. I really want to do what's right for my clients, right? So how can I do that when there's so many words all the time? So I encourage y'all, you don't have to know every single term related to this population. You're never going to, and there are new terms every day, and I learn new terms every day. But what you can do, and what I encourage everyone to do, is to use the terms that people use to describe themselves. Use the terms that people use to describe their lived identities. Many people in the LGBT community put a lot of thought into how they describe themselves and their lived identities. And so I encourage y'all, if you take nothing else from this part of the training on terminology, use the terms that people use to describe themselves. And if someone uses a term that you don't know or understand, you can ask them about it and ask them what that means to them. Or you can also use Google. Google's your friend. Urban Dictionary is pretty up to date, right? So you'd be welcome to look things up there as well. So again, we're going to start here with some terminology on who is LGBT. What exactly does this mean? But before we jump into all of the letters that are involved with this community, we're going to look at some foundational language that applies to everybody, not just LGBT people. So we're going to look first at sexual orientation and gendered identity. Sexual orientation refers to who someone is attracted to, romantically, spiritually, emotionally, etc. Even though the word sexual is in it, it's not just about sex, right? There's so many ways that we're attracted to different people. And so sexual orientation has to do with who we are attracted to romantically, spiritually, emotionally, physically, etc. Gender identity has to do with how we think about ourselves in terms of our gender, okay? How we think about ourselves in terms of our gender, our self-concept, our self-understanding. And so it's like, am I a man? Am I a woman? Am I something in between? One way to remember gender identity is that gender identity comes from between your ears, okay, comes from between your ears, not from between your legs. Okay, gender identity comes from between your ears, not from between your legs. It doesn't matter what kind of genitalia, chromosomes, hormones, biology, any of that kind of stuff that you have, your gender identity comes from up here, comes from your brain. So Bodily makeup doesn't have anything to do with it. It has to do with how you think about yourself in terms of gender. Am I a man? Am I a woman? Am I something in between?